to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Bashar El-Jayousi. Thank you so much for being here, Doctor. We appreciate you joining us.
Thank you for having me.
Of course, you're welcome. Okay, so today we are talking about heart health. So first tell us a little bit about the Covenant Structural Heart Program and the services that it provides.
So the Covenant Structural Heart Program is basically an extension of the recommendations of the American College of Cardiology, which have recently tried to focus on team approach in taking care of patients instead of a single physician making all the decisions for the patient care. So this program consists of a few interventional cardiologists, a cardiothoracic surgeon, nurses, nurse coordinators that meet regularly to discuss patient care and specific patient information to make a team basically decision for the best approach to the patient care. So that's the first goal of having basically a heart program at Covenant. So we offer a variety of procedures that are basically minimally invasive to take care of multiple heart conditions. So instead of having to go to open heart surgery to take care of certain valve conditions, closing holes in the heart, we can do all of these things using a small arterial puncture in the groin, in the femoral artery, and be able to basically completely replace a valve or close a hole or take care of a leak in the heart without open heart surgery. So basically the two big things about this program is, number one, it is a team approach to patient care, and then number two, it's utilizing minimally invasive techniques to avoid open heart surgery to take care of a variety of heart conditions.
Those are very great attributes. Okay, doctor, tell us, there's something called the Watchman procedure. What's the Watchman procedure?
Yes, so the Watchman device and procedure is one of the procedures we offer at the Structural Heart Program at Covenant. So this procedure is intended to reduce the risk of stroke in patients with irregular heart rhythm, specifically atrial fibrillation, who cannot take blood thinners. So patients with atrial fibrillation, they are at risk of developing blood clots, which usually develop in a pocket in the left upper chamber of the heart called the appendage. So we call it the left atrial appendage. So this pocket is the site where most of the blood clots form in the heart. And the usual treatment for patients with atrial fibrillation to prevent the stroke and to prevent the development of these blood clots, put them on blood thinners, strong blood thinners like Eliquis, Xarelto, and warfarin. But some patients with atrial fibrillation cannot take these blood thinners because of bleeding problems, bleeding from the stomach, bleeding from the urinary tract, nose bleeding, or their profession involves risk of injury and they're concerned about having an injury and not being able to stop the bleeding. So patients cannot take blood thinners. This Watchman device is again placed through a minimally invasive approach through a small puncture in the vein, in the groin, in the femoral vein, where we basically plug this pocket in the heart so that even if blood clots form inside this pocket, they cannot go anywhere because we basically close the pocket with this device that's called Watchman. And this, of course, has been shown to be as effective as taking blood thinners in preventing strokes. And in addition to the benefit of eliminating the risk of bleeding that comes with the stronger blood thinners that are usually used in patients with atrial fibrillation. So after 6 months of this procedure, the patient will only need to take an aspirin, and that doesn't need to take the stronger blood thinners for his atrial fibrillation.
Oh, that's great. Now, if people have more questions, who should they call, doctor?
So I think if anybody has a question, I think the first thing is to reach out to their primary care physician and primary cardiologist to ask if they are going to benefit from any of the procedures that the Covenant Structural Heart Program offers. But if they have additional questions after reaching out to their physicians, they can call our program and our clinic. And I don't know if you guys have the number for our Covenant Structural Program. but we can definitely provide that for you.
Yes, we'll definitely put that up. And doctor, you know, you hear so many wonderful things about Covenant and the cardiology program. What should people know about the Covenant cardiology program?
I think I want people to know that we at the Covenant Structural Heart Program, we are dedicated to our community, and we're going to continue to work hard to bring all new technology and advances in the field of cardiology here to our hometown to provide the care they need without having to travel outside of their home.
Okay, doctor, you know, especially during this pandemic, what is your #1 piece of heart health advice that you would tell everyone?
I think of course, in the current environment we're living in, I think with the pandemic, I think we should all listen to our public health professionals and follow the recommendations of social distancing and wearing our masks, and that would be very important. That's extremely important for patients with heart condition to avoid contacting the virus. But in general, outside the pandemic, I would say the usual advice in this situation that we say that we always have to adopt a healthy lifestyle and exercise regularly and diet. But I would like to focus today on one important aspect is I feel that patients should always take charge of their health and educate themselves about what's available so that they guide their treatment instead of being told what to do. I think
Yes.
Being in charge of your health is very important for a heart healthy condition overall. Being aware of your medications, following up with your doctors, and having routine follow-up appointments with your doctors and maintaining those is as important as diet and exercise and following all the good advices we get from our physicians.
I love that, doctor. I'm a big proponent of that as well, being proactive about your own health. Thank you so much for joining us today, doctor. We appreciate you. You're welcome. If you'd like any more information about today's topic, just head on over to the Hot Links page. That's on WNEM.com.